Okay everybody, this is a little video on shoulder dystocia, which is considered an obstetric emergency. Okay, so let's start with, remember we have 5 factors affecting labor and birth. Passenger, passageway, powers, position of the laboring woman, and psychologic response. So in shoulder dystocia, the first, second, and fourth factors listed here are going to affect the birth. So maternal history, so these are risk factors that you're going to look for that would give you an indication that this is a potential risk at birth. So has the mother gained excessive weight? Does she have abnormalities in her pelvis, so affecting the passageway? Does she have a narrow pelvis or a small pelvis? Think back to those pelvic shapes we talked about on the first day of class. The maternal diagnosis of uncontrolled diabetes. So that affects the passenger, right? That's going to make a big baby. And also a history of shoulder dystocia at previous birth. So then upon physical exam, what are you going to see? You'll see the mom has maybe gained some extra weight, leading to a bigger baby. Here's when you can also assess the shape and size of the pelvis, look for abnormalities, and you're going to look for a large fetus. You'll notice this through Leopold's maneuvers, through assessing McDonald's rule, and is also seen on ultrasound. And remember that large fetus is more than 4,000 grams. And then spilling of glucose on admission, that means that there's glucose in the urine. So then what are you going to see when the woman's laboring? So during the second stage of labor, you're going to notice that progress is slowing, right? Because the baby's stuck, so it's not moving forward as it should. And you'll also notice the turtle sign. This is the clinical sign of a shoulder dystocia. So the baby pushes its head out, and then it gets sucked back into the vaginal canal. It's not able to continue moving forward. Interventions, what are you going to do? You're going to have a stool next to the bed, ready to go. You're going to call for additional assistance. You're going to need help from other nurses, possibly the anesthesia provider, and also the neonatal resuscitation team, because when that baby comes out, it's going to need some help. So you're going to perform the McRoberts maneuver and provide suprapubic pressure from above. So the McRoberts maneuver is going to change the angle of the pelvis, as you can see here on the left, providing more room for the baby to come out. And suprapubic pressure is going to push on those shoulders to help move the baby out of the canal. Complications. Okay, so afterwards the mother can have postpartum hemorrhage due to tears and injuries to the vagina, perineum, and rectum. Neonatal complications. So possible asphyxia. Think about the baby's been in that vaginal canal and has been compressing. So possible hypoxic and acidosis injury. Possible brachial plexus injury and loss of arm related to damage to the nerves, possibly from pulling the baby out. And also fracture of the humerus or clavicle, so that can be related to that suprapubic pressure applied to push the baby out of the canal. That's it. Hi everyone.